Hello, everyone. Welcome to Unpontificated. In this episode, I will be talking about a bill a friend of mine highlighted or brought this bill to my attention, Bill C-293. This is a bill from the Parliament of Canada. And he said I should give it a read and see what I thought, because he said it was very serious. But okay, friend. Hi, Paul. I said I will give it a read and see what it's all about. So I kind of wanted to talk about this bill. I found this from the Toronto Sun from a fellow, someone called Sylvain Chalebois. He says, is Bill C-293 Canada's Vegan Act? So this was an interesting title, but it kind of highlights his thoughts on what Bill C-293 is. And then you can read your Bill C-293, a private member's bill that recently advanced through the House of Commons with little resistance, purports to bolster Canada's pandemic preparedness. Yet a deeper analysis exposes provisions that could disastrously impact the agriculture and agri-food sector, which are vital to our national economy and food security. Interesting. Under this bill, public health officials could have the authority to close facilities they consider high risk, such as meat packing plants, during pandemics, and even mandate the consumption of vegetable proteins by Canadians. Measures that border on the absurd. It's hardly surprising that the private member who introduced Bill 293 is Liberal MP Nathaniel Erskine Smith, who is known for his vegan lifestyle. Okay, that is interesting, indeed, that a bill that may impact the agri-food sector has been forwarded by a vegan. Okay, so that's interesting. Mr. Chalebois goes on to say, highlight other things, but why don't we look at this bill and see what it's all about? So first I wanted to see what stage is it at and what stages did it go through. And you can see if you go into parl.ca and look at the bill, you can find out this bill did its first reading. I guess it was introduced on Friday, June 17th, 22. Introduction and first reading on this day, 22. So, well, we're already over 2 years, taking a bit of a while. But anyway, so second reading, February 8th, 23, went to committee, October 27th, 23, came back, reported stage. And I guess after they've done whatever they did in the committee, on Monday, June 3rd, 24, third reading was completed on Wednesday, June 25 of 24. So third reading is when it went to, I guess, to agree to vote. And vote number 802, I found quite interesting. If we click on that, you can see that this vote, by the way, there's the sponsor of the VIT, of the bill, Mr. Nathaniel Erskine Smith, a liberal from Beaches, East York. If you guys don't agree with this bill, then vote him out in the next election. In the meantime, I was interested in this vote. Like, how did this vote go? So obviously agreed to was 164, 144 were nays. They didn't like this bill. Paired with 12 with a total of 308. So I wanted to see the political affiliation. And if you look here, you'll see that all the liberals said yes. No liberals said no. All the conservatives said no. No conservatives said yes. All the bloc said no. Well, the NDP said yes. That's forget this vote was held on June 5, 24. So I mean, this just talks about the state of politics. Obviously, it was a whipped vote. I mean, no liberal could vote with his or her own conscience or with the conscience of their constituents. They had to vote yes. No conservative was allowed to vote their conscience or vote with their constituents because they all said no. Same with the Bloc. I mean, the NDP, this is a liberal NDP government. Right now, Jagmeet said he tore up the agreement that they had, but I mean, this was before he tore up the agreement. But he's still working with them right now anyway. It would have been interesting just to see if there were some conservatives who said yes, some liberals who said no, so we could see that this was an actual a vote that represented the people. But no, it was not. The liberals voted for it, as did the NDP, because they're voting with the liberals so that they don't kick them out of this minority government. And the conservatives voted nay, just to be contrary. It's a little disappointing, even if I would think I would vote nay myself on this. I think it's a shame that people can't just vote with what their constituents would want them to vote, or vote their own consciences. So what is this? Anyway, so this reading was completed on June and voted. June 5, went to the Senate, completed the first reading on June 6, and the second reading is in progress right now, as of October 22. According to this, still in second reading, third reading, but yet. So the Senate is reading it. They may have some changes that they want to make to it, to bring it back to the House for them to make the changes and vote on, and then send it back to the Senate. Anyway, so the process is still going on. So what is it? Let's look right here. This is Bill C-293, and it's an act respecting pandemic prevention and preparedness. So my spidey sense is already going off, because when you talk about pandemic prevention and preparedness, that's fine. I'd like to prevent a pandemic, and failing that, it'd be good to be prepared for a pandemic. But what does that mean? What do you mean prevent a pandemic? And what do you mean prepare for a pandemic? Because if you look at what happened during COVID-19, like, do you mean everyone has to get a vaccine to prevent this pandemic? Is that what you mean? That's why my spidey senses go up. Because anytime the government gets involved in what it is we can do, what decisions we can make for ourselves, it becomes a problem. So we'll look at it briefly. It's not too long. Here's the preamble. Whereas the costs of prevention and preparedness measures are insignificant in comparison to the human and economic costs of the pandemic. Okay, sure. I mean, they always say, the saying, prevention is better than a cure. What are the costs? Like, where's our money going? That's why I'm kind of laughing. Like, what do you mean? Because that's a nice sentence, and it makes sense. Like, would you rather prevent the pandemic than go through one? Yeah, I would. I would rather prevent one. But what do you mean? Whereas Parliament is committed to making efforts to prevent the risk of and prepare for future pandemics, to promote transparency and accountability in relation to these efforts. Whereas it is critical to build on the lessons learned from previous outbreaks of serious diseases, including severe acute respiratory syndrome, SARS, Ebola, Zika, tuberculosis, H1N1, and of course, COVID-19. I wonder what lessons they're going to take from what they did during COVID, right? But the lessons they should take from those countries or communities like states in Florida that did not close down schools, right? That did not close down businesses, and didn't fare any worse than a lot of places that did close down schools, did close down businesses, did say there's no not allowed to go to weddings or funerals, or close down churches. Here in Canada, we did all that closing down of schools, businesses, churches, and we just closed down the small businesses because the Walmarts and the Home Depots of the world were allowed to stay open, which was just brutal on small businesses, and some haven't been able to come back. Many restaurants never came back from the COVID measures. So are they going to learn from that and not to do that anymore? Whereas a One Health approach, a multi-sectoral and multidisciplinary collaborative approach that focuses on the human, animal, plant, and ecosystem health and welfare interface is central to preventing the risk of future pandemics. Anytime you talk about a One Health approach, because here in Canada, provinces are responsible for the health mandates of its people. It's not a federal jurisdiction, it's a provincial jurisdiction. So what Albertans might decide to do might be different from what Ontarians decide to do, might be different from what Nova Scotians decide to do. And each province knows its province better than the next person, or better than the government does. So this going into One Health approach, is similar to the WHO having mandates over the world. You've got to keep things small as possible. And whereas this approach requires sustained collaboration among various ministers, all levels of government and Indigenous communities, now therefore His Majesty, by and with the advice and consent of the Senate and House of Commons, Canada, enact as follows. This act may be cited as the Pandemic Prevention and Preparedness Act. So this is what Bill C-293 is. And the purpose of this act is to prevent the risk of and prepare for future pandemics, and to promote transparency and accountability in relation to the government of Canada's efforts to do so. All right, so let's read the plan. This is the plan. First of all, the Minister of Health must establish a pandemic prevention and preparedness plan. So Minister of Health has no choice. You must present this plan as outlined here in the plan. Set out a summary of mitigation strategies. In the words of mitigation strategies that the Minister of Health intends to implement in order to prevent the risk of and prepare for disease outbreaks that could lead to pandemics, as well as a projected timeline for their implementation. Okay, sounds good. Identify the key drivers of pandemic risk and describe how Canadian activities, domestic and abroad, contribute to the risk. Here we go. So, Canadian activities. Here we are about to get our activities looked at and controlled or restricted. Let's see what else we got going here. Ensure sustained collaboration between the Minister of Health and provincial governments and Indigenous communities in the development of the plan in order to align approaches and address any jurisdictional challenges, including with respect to the collection and sharing of data. Okay, so at least there's acknowledgement that we have different jurisdictions here. And when you say ensure sustained collaboration, like let's say a provincial government says, no, we're not going to do that. What's that going to mean? Like, how are you going to enforce this collaboration? Because you may have a provincial government that says, no, that doesn't work with our province. We're not doing that. And then what? So that's a problem. Provide for training programs, including collaborative activities with other levels of government, Indigenous communities, and relevant agencies. show that standards and guidelines that pertain to the prevention of and response to pandemic risk aligned with the approach described in paragraph 3A. We'll get to that later. Describe the state of research in relation to prevention and responding to infectious diseases that could lead to pandemics. This is another problem because who are you going to be listening to? Are you just going to listen to those people who you want to agree with, who are going to talk about controlling the population and restricting the population's movements and what they can do with their bodies? Or are you going to look at all research? Because there's plenty of immunologists and people who deal with viruses, virologists, who had research that was contrary to the ones that the governments were listening to. And they were just, shut down. So this described the state of research, like which research, And this is, again, a problem. Provide for the establishment and interlinking of surveillance systems for infectious diseases in Canada and for infectious diseases of concern outside Canada. I don't know what that means, interlinking of systems. Like you're going to link with other countries' systems. I don't know. Support local public health and primary care capacity building. Identify preparedness strategies for public health services across Canada, including in respect of the protection of vulnerable and marginalized populations. The vulnerable, I get, the elderly, those people with compromised immunity. What do you mean by marginalized? Even though in the case of COVID, it was determined that kids were not affected as much as the elderly were, so closing down schools was not necessary. Marginalized, what do you mean? Like Black, Indigenous, trans? What does this marginalized population mean? I hope what they mean is like maybe poor populations, people in poverty. So not looking at race or those things, but look at maybe class. Like poor populations is what I would consider marginalized. But these don't go by, Black people are more likely to be affected by pandemics. So we really need to look at that, because that's just stupid. Working conditions of essential workers across all sectors. Okay. The availability and management of relevant stockpiles, including testing equipment and personal protective equipment. Okay. Surge capacity of human resources required for the testing and contact tracing of persons exposed to infectious diseases and communication of risk to the public. Testing and contact tracing. Contact tracing. Where are you? Big brother wants to know. See, my only thing with this is I kind of like what we did with SARS. If someone was sick, they stayed home, and they had to stay home away from the population. So if you're sick, stay home. That's what we should be doing. But if I'm not sick and I travel to New Brunswick, why do you need to know where I am? Oh, come on. Come on, man. Provide for measures, including training, to increase the ability provide for measures, including training, to increase the ability of healthcare workers in a range of settings to manage sudden and unexpected increases in patient volume. Include the following information to be provided by the Minister of Industry. The manufacturing capacity in Canada with respect to any product relevant to the pandemic. Include the following information to be provided by the Minister of Industry. The manufacturing capacity in Canada with respect to any product relevant to pandemic preparedness, including vaccines, testing equipment, PPEs, and the measures that the Minister of Industry intends to take to address any supply chain gaps identified. On the communications capacity and infrastructure of electronic platforms and tools including electronic applications that enable contact tracing of persons exposed to infectious diseases that could lead to pandemics. After consultation with the Minister of Agriculture and Agri-Food, the Minister of Industry and provincial governments provide measures necessary to reduce the risk posed by antimicrobial resistance. Regulate commercial activities that can contribute to pandemic risk, including industrial animal agriculture. Oh, I see. This is where that Mr. Sylvain Charlebois was talking about this kind of thing. Promote commercial activities can help reduce pandemic risk, including the production of alternative proteins. I mean, beans as opposed to beef. Don't forget, this guy introduced this bill as a vegan. So he isn't eating meat, drinking milk. He's eating beans and tofu. Phase out commercial activities that disproportionately contribute to pandemic risk, including activities that involve high-risk species. Here we go. Now, what is a high-risk species? Is that mentioned here? Because, yeah, so we need some specifics. Include the following information to be provided by the Minister of the Environment. After consultation with relevant provincial ministers, a summary of changes in land use in Canada. What? Including in relation to disturbed habitats that could contribute to the pandemic risks, such as deforestation, encroachment on wildlife habitats, and urbanization, and that were made in the case of the first plan since the last report on changes in land use were published under the Federal Sustainable Development Act, or in the case of the updated plans during the reporting period for the updated plan. A summary of the measures of the Ministry of Environment intends to take to reduce the risk that the commercial wildlife trade in Canada and abroad will lead to a pandemic, including measures to regulate, phase out live animal markets. Including measures to regulate or phase out live animal markets. So this guy wants to infringe on other people's commercial businesses, so to speak, because he disagrees with those markets. He obviously disagrees with live animal markets, whether someone like, I'm not sure, I haven't done any kind of research on what the live animal market might be, but I am assuming like maybe seals, sharks, those kind of things, or I guess any market or any animal that you talk about. Like, is this dogs, like sending dogs overseas, or someone bringing dogs into Canada? Zoos, like, I don't know, like if, say, something like Marineland, is still around, wants to bring in some sort of shark into Canada. How does this work? I mean, I think this is already regulated, isn't it? But why do you want it phased out? See, these kind of things just bother me. A summary of the measures the Ministry of Environment intends to take to protect global biodiversity and to halt and reverse global deforestation. Yeah, this guy's obviously a tree hugger, that kind of thing. Because we already, I believe in Canada, I could be wrong, again, more research needed by me, but I think we're planting more trees right now than we're deforesting, than we're removing, because that is mandates by all governments, is that we need to plant trees if we're getting rid of trees. So we are doing things to protect the global biodiversity. And so, I mean, maybe we're not doing it fast enough. I have to take a look at that, but tree planting has been going on forever. Remember, people still take summer jobs and go tree plant. So I don't know. Sometimes people just like to put things in bills that are actually happening, and and there's no need for it. Include a summary to be provided by the Ministry of Foreign Affairs of the measures that the minister intends to take to support global health equity, including measures to increase public health capacity around the world and to ensure equitable access to vaccines, testing equipment, and treatment. So when I read vaccines, I start to, I'm already going through PTSD. Set out in consultation with relevant ministers a summary of key cooperative measures or agreements on disease outbreak prevention and preparedness between the government of Canada, other foreign governments, and key international organizations, including the WHO, the United Nations Environmental Program, the World Organization for Animal Health, and the Food and Agriculture Organization of the United Nations, and set out in consultation with the Minister of Transport, the Minister of Public Safety and Emergency Preparedness, and other relevant ministers, the routes by which the rates, by which and rates at which pathogens that could lead to pandemics could enter Canada, and a summary of water-related measures that would be implemented to reduce any risk. Anyway, guys, I'm not going to read anymore. You can read the rest. It's really not that long. But you can see what this is happening. I did come across this concern that the Alberta government's concerns about the federal pandemic bill. Of course, Prof says it reflects conspiracy theories, but anyway. But these are guys who have some concerns. Alberta is voicing concerns about a federal bill aimed at bolstering protections of what the province says is government overreach. So the province says it's government overreach. The province calls the bill highly intrusive and says it unfairly singles out agriculture and food industry while encroaching on provincial jurisdiction. Exactly. That's right, it does. Williams said the province's, Williams is this minister, this Lori here, the professor, says the province's concerns about jurisdictional overreach are vague, and in some cases, the federal government does actually have a legitimate say in how provinces oversee health and agriculture. Yeah, they can say something, but I don't know if they can't make them do anything. So that's a problem. Like, how are you going to enforce some of these things? Are you going to make some changes to the Health Act that allows the federal government to enforce things on the provinces regarding health? That's not good. Portions of the bill state that the government would plan to promote commercial activities that help reduce pandemic risk, including the production of alternative proteins, and phase out commercial activities that disproportionately contribute to pandemic risk, including activities that involve high-risk species. Yeah, we read this when we were reading the bill. We read that very paragraph. And the province, this is how the province interprets that. We usually said the bill would allow Canadian government to mandate the consumption of vegetable proteins by Canadians. It opens the door for the federal government to tell Canadians what they can eat. Yeah, it looks like that. How are they going to force us to eat that? They're going to tell our grocery stores what they can sell. And if the grocery stores don't have it, then we won't eat it because we can't buy it. And again, that's a problem. Williams said some of these concerns reflect, this again, the whatever, Lori Williams, reflect some sort of conspiracy theory, although there is room to improve on the language contained in the bill, she said. Yeah, there's lots of room to improve on the language. In other words, the language of the bill should specifically say, we will not restrict meat. We will not restrict what Canadians can eat. That's the room. You can't have this vague open to interpretation bill, because if it's open to interpretation, any government can come in and say, this is what it says. So this is the Alberta Minister of Agriculture and Irrigation, Mr. Sigurdsson, called on the federal government to reconsider the bill in its current form. Bill C-293 goes so far as to pick winners and losers within the agriculture sector, with potentially wide-reaching, catastrophically damaging regulations and restriction of commercial freedoms for agricultural producers and processors. And the Minister of Health, Adriana Lagrange, says the bill would intrude upon the province's jurisdiction to manage its healthcare system and public health emergencies. Exactly. And how are you going to enforce them if they say no, because you're intruding? That's kind of scary. So, and she's right, local governing bodies are in the best position to create emergency preparedness plans that suit the unique needs of their province and territory. Amen, Adriana Lagrange. So, Bill C-293. Oh, yeah, let's see here, Mr. Erskine Smith. This is the fellow, the vegan, who introduced the bill, sponsored the bill, told CBT News the focus of the bill would require the federal government to come up with a plan to prevent and prepare for the next pandemic. Yeah, we know. It's pretty much as simple as that, he said. I'm open to amendments, but the idea is to manage and reduce risks. Erskine Smith said opponents of the bill assumed the federal government would attempt to wipe out meat production in Canada, which he dismissed. It's not about eliminating that agriculture. That would be ridiculous, he said. Just as global travel represents a pandemic risk, we're not going to eliminate global travel. I mean, just that sentence is, or that statement is, we're not going to eliminate global travel. Mr. Erskine Smith, you pretty much eliminate global travel for those people who were not vaccinated during the pandemic. So I don't know where you were. I don't know what you were thinking when you made that statement. But people who weren't vaccinated couldn't travel. You did eliminate it. So when you're talking about this, what you're basically saying is that should another pandemic occur, for 2 years, people will not be allowed to eat meat. That's what you're saying, right? For 2 years, you have to eat other kinds of proteins. You have to eat beans, lentils, yogurt. Actually, you could even drink yogurt. I mean, that's not a vegan product, right? So that's what you're saying. So we may be able to eat meat when the pandemic's over, but during the pandemic time, you want to restrict what it is we can eat. Not good. Not good. Asked about what he would say in response to Alberta farmers who are concerned about the wording of the bill, Erskine Smith said, you are not causing disproportionate risk, so you shouldn't worry at all about that particular section. He added, when it comes to regulating activities, Canada already has really strong rules in place. This is not opposition to the industry. This is about making sure we manage and reduce risk. Being Mr. Smith, Mr. Erskine Smith, nice words, you really are a politician. But you said you're not causing disproportionate risk, but are they causing risk in your mind? Whether you consider it disproportionate or not? So who does cause disproportionate risk? Does he say that here? Of commercial activities outlined in the bill, Erskine Smith says his intention was to make certain rules around biosecurity in the agriculture sector mandatory rather than voluntary. If assess is the right language rather than regulate, have at it. The Senate has the power to make these changes and to make sure they fine-tune the language of the bill and get it right. That makes perfect sense to me. Doesn't make sense to me, Mr. Erskine Smith. When you talk about mandatory things, certain rules around biosecurity in the agriculture sector mandatory. It's my spidey senses go up. Is it spidey sense? My BS senses go up. My BS radar is up. Anyway, guys, there you have it. That is Bill C-293. I have looked at it, buddy. And you're right. It does look kind of scary. It is in its third reading. Well, it's in its second reading at the Senate. So it is going through pretty quick. I think I read somewhere that if an election does come before the bill has finished its third reading, before the bill becomes law, then the bill is thrown out. Anything that is in reading that has not been completed before the next election is then discarded. So in its current form, I think this bill does need to be discarded. It is too vague. It is too open to interpretation. One of the things that that I get from it is, one, it certainly will restrict during a pandemic. It will restrict what we can eat. It will restrict. I think that's the big one there on this bill for me. All the other things will be in place according to this bill. It'll restrict where we can go, where we can travel. It also seems to restrict what we can do when we travel. It's so 1984-ish. But anyway, you guys can decide what you think about the bill. I would appreciate a like and share. Please share this all around, because I think this bill should be made known to everybody, every Canadian, so they can be aware of it. Maybe write their member of parliament that they disagree with the bill, certainly in its current form. The heading sounds good. I mean, who doesn't want to prevent a pandemic? I do. Who doesn't want to be prepared for a pandemic? I want to be prepared for a pandemic. I want to prevent a pandemic. But we have to be careful of what we allow our government to do to us. And you saw what happened during COVID. Businesses closed down, restrictions on movement. And we also saw what happened to the truckers who went to Ottawa. Their bank accounts were frozen in Canada. We can't allow this kind of stuff to go on. So I'm certainly going to write my Minister of Parliament, let him know that I don't like it. And I hope you guys do too. So yeah, please share this. Let people become more aware of this bill that's going through pretty quickly through the Senate. And I'll be keeping an eye on it myself. So yeah, please like, guys, if you like this content, and I will see you on the next episode.